Hello there, my name is Matthew Garcia, and this is my subcutaneous checkoff video. So I just want to first start off by showing you my vitamin B12 medication med chart. I also have the Anna BMS paper chart I'm using as EHR or EMR. I'm going to go ahead and begin. So I just want to start off by saying the three subcutaneous injection sites, which is the outer posterior part of the upper arm, and then the abdomen from the lower costal margins to the iliac crest, and the anterior aspect of the upper thigh. So those are three subcutaneous injection sites. And then I'm gonna go ahead and start by sanitizing, washing my hands. I'm gonna go ahead and start by locating the MR, which is right here. So I have Anna Pawlowski, May 5th, 1957. Her allergies, penicillin and hives. And then I'll just go through the entire MAR, looking at it, and then I'll go and look for B12. So I see B12, verify the order with the doctors. So I see B12 subcutaneous, and I do verify that. And I'll go ahead and retrieve the B12. So I'm using this vial as B12. I'm gonna go ahead and do my first medication check. So I have Anna Pawlowski B12 500 mcg subcutaneous, 1458. So after doing my first check, I'm gonna go ahead and check the expiration. So I see that the medication is not expired, which is perfect. So then I'm gonna go ahead and consult my drug worksheet. So side effects are hypertension, erythema, rash, red urine, anaphylaxis. And assessments I need to do is monitor BP and pulse, as well as vitamin B12 levels. So after I have all that, I'm gonna go ahead and calculate the dosage. So it's 500 mcg right now, but I need to convert it to ml, so it's gonna be 0.5 ml. Then I'm gonna go ahead and select the right syringe. So I have the 1 milliliter 25 gauge and 5/8 inch syringe needle I'm using for subcutaneous injection. And then I'm gonna go ahead and do my second check. So I have Anna Pawlowski B12 500 mcg subcutaneous, 1458. So then I'm sorry, excuse me. And then I'm gonna go ahead and have the vial. And if it is my first time opening, I'll time to initial it, but it is not. So I'm just gonna go ahead and clean the rubber part of this vial. I'll clean it for 30 seconds. After cleaning the rubber part for 30 seconds, I'll let it air dry. I'm just gonna go ahead and get the needle. And I'm just gonna go ahead and uncap the needle. Okay, so uncapping. Go ahead and withdraw 0.5 milliliters of air first. Okay, go ahead and insert. And I'm just gonna be doing air to air, so 0.5 milliliters air into the vial. I'll go ahead and invert it. Look at it at eye level. Slowly bring up 0.5 milliliters. Okay, go ahead and tap out any air bubbles. Okay, turn it back upside down. Take it out. I'm gonna go ahead and recap. So, recap it. And normally I'd put a barcode on it, but I put a piece of tape on it to act as a barcode for later on. And I'm gonna go ahead and assess, along with that, I'm gonna go ahead and assemble necessary equipment, my gloves, the medication, alcohol wipes, gauze, EMR, and then usually I would have the sharps container as well. So I'm gonna go ahead and go to the room with my equipment, knock, sanitize my hands. Now I'm gonna go ahead and introduce myself. Hello there, my name is Matt. I'll be a student nurse for today. Can I have your name and date of birth? So Anna Pawlowski, May 5th, 1957. Do you have any, I'll verify that in the computer, verify in the wristband. Do you have any allergies I should know about? Oh, penicillin, what is your reaction? Hives, okay, so verify wristband, verify computer. So once I have that, I'll go ahead and state what I'm here. So I'm here to do a subcutaneous injection. I'm going to be giving you B12 just to increase the your B12 levels in your body. I'm going to go ahead and assure patient safety. So bed at its lowest height, side rails are up, call light within reach, and brakes are locked. So patient safety is good. I'm going to go ahead and close the curtain, privacy curtains, and we'll begin. So first thing I'm going to do is do the assessments from my med chart, and so I'm going to go ahead and get the blood pressure, go ahead and get the pulse, and go ahead and get the vitamin B12 levels as well. Then I'm going to go ahead and for my teaching, I'm going to go ahead and just let teacher the side effects. So hypertension, erythema, rash, and red urine are the most common side effects, and severe side effects are anaphylaxis. So I'll just teach her about that, and I'll go ahead and do my third check. So I have Anapolowski B12 0.5 milliliters subcutaneous, and time is 14:58. I'll go ahead and scan the barcode. I'll go ahead and scan the barcode on the wristband as well. And after scanning the barcode, I'm going to go ahead and grab the alcohol pads. No, first I'm going to go ahead and sanitize my hands. So I'm going to go ahead and sanitize. And then go ahead and put on my gloves. And I'll tell the patient just to position them. So if you could just sit up for me, sit straight, and then I'll be using the anterior aspect of the thigh. So this is going to be the anterior aspect of the thigh. Go ahead and retrieve alcohol pad. So first thing I'll do is locate where I'm gonna inject, and then I'll start at the center, and then I'll go in circular motions going towards the outside for 30 seconds. And after that, I'll go ahead, let it air dry, and then I'll go ahead and get my syringe uncapped. And go ahead and pinch the skin. I see that there's enough fat to go at a 90-degree angle, so I'm just gonna go ahead and go at a 90-degree angle. Slowly inject the 0.5 milliliters. Okay, let go of the skin. I'll go ahead, get my gauze. Oh, could you apply some pressure for me? Light pressure, just don't massage it, light pressure, okay? I'll go ahead, recap. Needle safety, and then I'll throw it away in the sharp container. Gauze here, and then after I'll go ahead and remove any medical waste, any medical materials. Go ahead and take off my gloves. And I'm gonna go ahead and document that I gave the vitamin B12 0.5 milliliters subcutaneous. Go ahead and document that. I'll go ahead and state any assessment findings, so the blood pressure, pulse, vitamin B12 levels, and then I'd go ahead and assure the patient safety. So bed at its lowest height, side rails are up, call light within reach, brakes are locked, and there's no clutter equipment anywhere. So patient safety is good. I'll go ahead and ask if the patient's comfortable. Are you comfortable? Do you need anything before I go? No? Okay, perfect. I'm gonna go ahead and open up the curtain. And then I'll go ahead and open the door, foam out. So, and that'll conclude my subcutaneous injection checkoff. Thank you.